Zachary David Alexander Efron. What did he do? It's all over Twitter. He did an interview. There's a picture from that interview where his face is swollen and everyone said he's had Botox. He's had plastic surgery. Today, I'm gonna look at those pictures, a couple from when he was even younger. We're gonna look at what may have been done, but I know one thing everyone's talking about that's dead wrong, and it shows the misconception with aesthetics today. All I heard over in the internet, over social media was, he had Botox, he had Botox, it was Botox. Botox doesn't do anything like that. It doesn't volumize the face. If you want to know what it does, go to my videos that show all about Botox, how it works, the before and afters, watch it being injected on this channel. It's not Botox, but let's dive into some pictures and see what exactly he may have done. So one of the things we can see that was done early on is his smile. If you look at the teeth, there's a gap between the teeth, and the teeth certainly look different in this picture. Very common for people to have dental work, especially in Hollywood. But I want you to pay attention also to the nose and the chin. The picture that's in question is this one. This is what everyone's talking about, and what they're looking is volume here, looking at the chin projection. They're wondering, did he have lip fillers done? And one of the other questions was something along the jawline or jaw implants. Why does his face look so big? Why does he look puffy? And a lot of people wonder if he's done something similar to what The Weeknd did. To understand it, let's go back to 2017. What you see with a youthful face is that V line. So you see that there's not a lot of fat down in the jaw area, and the eyes are nice and wide open. Look at the brows, as I'm gonna make a comparison with the brows for the picture people are looking at now. If we look at 2020, still a little bit of volume here, but still has that nice V shape. He's always had good lip volume, but if you look here at the edge, there's no lip at the edges, and it's common to lose it when people smile. But notice the size of the lip. Again, the brow is still lifted here, and there's volume in the cheek. If we do look at this picture, however, we start to see some facial aging. What is that? Descent of fat. That's why we're always lifting faces. Again, pay attention to the lips, look at the eyes, not a lot of sag. Now let's look at the picture in question and compare. When we come to this picture, of note, the face is bigger. There's more volume, lower. Now, this could be one of a few things, but let's pick apart the lip filler. Certainly there's more lip volume here, so we know something happened. There's more volume in the lower jaw area. I want to pay particular attention. Look at that square chin. So a larger face overall, only a few things can do that, and there's two options here. Number one is if he did have plastic surgery and was recovering from it, there would be a degree of swelling. And one might say, well, why would he ever do a chin implant? He's always had a stronger chin. But let's go look at his profile real quick. If we look at this picture here and we were to draw what we call the AE or rickets line that I talk about all the time, you can see that the chin isn't necessarily as strong as maybe a Hollywood chin would be. Certainly a great jawline and chin, but it wouldn't be unusual to add a little more forward projection, especially now because the chin is in. Let's go back and look at that picture. I want to close picture in for you so you can compare the chin before to the chin now. I zoomed in on the chin so we can see a before picture over here and the one in question. Not as high res as we want, but it was taken from a video. Certainly had a nice shape to his chin, but it definitely seems more defined now. So that is what people are talking about, a chin implant, jawline surgery. It certainly is possible. Surgically, if he was recovering from a facelift, you could have swelling and a chin implant could be part of it. The other things that can cause a swollen face, however, are systemic things. Things that people might put in their body or have done that would cause systemic swelling. Being on steroids for like an allergic reaction, let's say. And we know someone else had one of those.
Really, it is not that serious.
lot of Benadryl. A lot of Benadryl.
We also know Zac sometimes works out for his films. And if you see in the picture in that interview, even looking at him here, you can see he looks like he may have gained some weight. He certainly has big traps. Maybe he's been working out, and overall what we're seeing is a bloating of the face. If we're going with the surgical option, one can see from this picture that if he didn't gain overall weight, it's not Botox like people are talking about, but it looks much more like dermal filler. If it's not water, fluid, and weight for one reason or another, which could also inflate the lips a little bit, then it certainly could be dermal filler, but not Botox. One of the factors that goes along with overall weight gain is the puffy eyes. If you look at his eyes, and I showed you the pictures from before, the eye was much more open and awake. Now he almost has fluid or a bagginess around the eyes, which indicates it might be an overall gain of weight or fluid. So I'm personally going with an overall gain of weight, maybe a little surgery in the lower face. I know from looking at other pictures, he may have had a little bit of lip volume added from time to time. He has had dental work for sure. And if you've been in Hollywood since the age of 11, you're no stranger to seeing and having or being around and having the opportunity to having cosmetic procedures. Almost everyone in Hollywood does. A lot of people have made their career and received a career because of the procedures they've had. They wouldn't have had that career without that. For him, he's just pure raw talent. He didn't need any of it. But of course, when you're around it, you tend to take the opportunity and consider getting things done, especially as we age. But keep in mind, the aging face gains weight. Let's look at Leonardo real quick. Here's a good demonstration of a younger face and one that's more mature. You see overall weight gain, the loss of that beautiful kind of a V shape to a more square, which is accepted in the male, but not so much the female. And it may be one of the reasons the male careers tend to be longer in Hollywood than the female. But you can see, again here, overall volume. What do you think was done? What did Zac Efron do to his face? And will it just look normal back to the way he was in another month or two? I put a whole playlist up here of celebrity videos for those who like this type of video. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.